Now we're looking at the next type of drugs, which is used in treating diabetes mellitus, and these are the non-peptide derivative agents. We have looked at the peptide derivative agents, spoken about their use, spoken about the various examples of drugs under that classification. Now we're going to the non-peptide derivative agents now. So for these non-peptide derivative agents, we have the following. Of course, this is a summary of diabetes mellitus. You can get to look at diabetes mellitus type 1. You can get to look at the diabetes mellitus type 2. So the pharmacotherapy of diabetes mellitus is you can use a peptide derivative, you can use a non-peptide derivative. So for the non-peptide derivative, we said that these are drugs that are not peptide hormones. They are not insulin or GLP-1 analogs or amylin, but they are just small molecules. They are taken orally, sometimes parenterally. So examples, you have the Biguanides. So drugs like Metformin. How does it work? This is just a summary. We'll come back and talk about their pharmacology one by one. So Metformin decreases hepatic glucose production. Do you understand? So it will increase insulin sensitivity. So there's not much glucose. So insulin is now working more. So there's decreases fasting glucose, improves what? Hemoglobin 1AC. So, well, advantages: weight neutral, modest loss, or low risk of hypoglycemia, cardiovascular benefit. This is Metformin here. Okay, so also have the sulfonylureas like the glibenclamide, the glipizide, the gliclazide. So they stimulate pancreatic beta cells to release insulin by closing the ATP sensitive potassium channels. So effect is the decreased blood glucose rapidly. It's very effective, it's inexpensive. Then we have this is glibenclamide. Other examples include the meglitinides, also known as the glinides. So drugs like the repaglinide, the natglinide, similar to sulfonylureas, but they act shorter. Okay, so they target postprandial glucose. After you eat, if glucose is increasing, they actually target that. Okay, so that's what we got. Then we have other drugs like the thiazolidinediones. So drugs like the pioglitazone, the rosiglitazone. So they activate the gamma receptors. They increase insulin sensitivity in fat cells, in muscle cells, in liver cells. So this will decrease insulin resistance. It will improve the lipid profile. Then we have the alpha glucosidase inhibitors. So drugs like the acarbose, the miglitol, they delay carbohydrate digestion and absorption in the intestine. Do you understand? So it will basically reduce those times of carbohydrate shooting up, reduce it. Then we have the SGLT2 inhibitors. So drugs like the dapagliflozin, empagliflozin, canagliflozin. So they block the sodium glucose cotransporter 2 in kidneys. This will increase how the glucose is being excreted in urine. Okay, it will decrease glucose. There's modest weight loss. There's decreased blood pressure. Okay, so we have the DPP4 inhibitors. So drugs like the sitagliptin, the sazagliptin, the linagliptin. They inhibit the dipeptidyl peptidase. So it leads to prolonged endogenous incretin and increase what? Insulin release. Okay. Okay, so that's what we got. Dapagliflozin. Then lastly, we have other agents like the cholecalciferol, the bromocriptine, the icosapent ethyl. That's an omega-3 derivative. Okay, so that's what we got.